Canine treatment and rehabilitation. Now, there are many causes for soft muscle injuries, such as poor flexibility, inadequate warm-up, fatigue, sudden forceful contraction, hyperextension, strength imbalances, and intense interval training without sufficient breaks. Now, there are 3 ways to grade a soft tissue injury. The first grade is micro-tearing of the inner fibers within the structure, but the sheath is still intact. Grade 2 is both micro and macro tearing of the inner fiber and sheath. Grade 3 is the complete rupture of the fiber, and surgery is needed in order to fix the damage. Now, since the nerve fibers have ruptured completely, the animal will exhibit less pain, but the associated joints will be unstable. In order to determine the severity of the injury, knowledge of anatomy and palpation skills are needed. Irritability on palpation is correlated with specific muscle stretching, called a stress test. Now, the strained muscle or tendon will be painful to a certain stretch that is done. There are 3 stages of healing. Treatment should be used to relieve pain, facilitate injury, and identify and correct the cause of the injury. The first stage is the hemorrhagic phase. Now, this will occur within the first 24 to 48 hours. There's cellular change and swelling. Treatment should be directed towards minimizing the initial bleeding, controlling swelling and inflammation, preventing stress and tension on the limb, and reducing the pain. Now, in order to do this, we will use the RICE principle. This stands for rest, ice, compression, and elevation. Rest is only beneficial within the first 24 hours in order to stop the active bleeding. Ice is used to reduce the swelling by promoting vasoconstriction. Now, a general rule of thumb is that ice should only be applied for 10 to 15 minutes. Otherwise, it will cause more bleeding and swelling. Compression is used in order to help stabilize the affected joint. Now, elevation is a good idea in theory, but with our canine companions, it's not always practical. So, use non-stick surfaces and adequate confinement instead. Stage 2 is the regeneration phase. This will be from day 5 to day 21, but it can last up to 15 weeks depending on the severity of the injury. Now, this is where new collagen fibers will form. The cells will lay down new, small, and weak fibers in a disorganized fashion. Treatment should be directed towards helping the new fibers to align in the strongest format possible. Strengthening should begin once pain has subsided. Enhancing circulation to the affected area will allow the delivery of oxygen and nutrients to the healing area and stop inflammation. Now, encouraging tissue regeneration and metabolism is also needed, along with restoring coordination and body awareness. This will avoid re-injury. Some ways that you can do this would be joint compression and balancing activities, but not very challenging ones, because you do not want to re-injure the area. So try walking over poles or on even surfaces. Stage 3 is the remodeling phase. This will be within week 6 to a year. Now, this is where the gradual return to normal function will take place. Treatment should be directed towards building up muscular strength, maintaining ligament extensibility, and enhancing joint mobility along with improvement of neuromotor control. This can be done by leash walks for a short distance and a little bit of off-leash running. Gradually, you can increase the length of time for your walk and your off-leash time. Destination jumping can also be beneficial, such as jumping onto a bed or over a small jump. Gated exercises can also be used, such as trotting up or down hills or in a zigzag motion. Now, gradual return to your activity should be modified, and you should have longer rest periods. Stretching is also very beneficial during this stage of rehabilitation. It will promote collagen orientation. More difficult balancing and displacement exercises should be used. You can use a wobble board or a miniature trampoline. Now, there are a couple ways that you can prevent injuries altogether. The first way is stretching. Now, stretching is related to performance and injury prevention, and it is specific to different sports. Now, more flexibility is needed for racing greyhounds or agility dogs, because there is the act of propulsion of both the fore and hind legs in racing greyhounds, and the rapid bursts of power needed for jumps and changing directions. In sled dogs, flexibility is not essential because they do not get over a trot and do not need to extend their joints fully. Overtraining is another thing that will help in preventing injury. Now, you should never overtrain your pet. You should give them adequate rest and recovery time. Be sure to monitor their appetite, body weight, behavioral changes, muscle soreness, and if they start to go down in performance, be sure to increase their recovery time. A warm-up will also help prevent injury. This will enhance muscle extensibility and improve oxygen intake. A cool down after a workout should be at least 20 minutes of walking, especially after a strenuous activity. Finally, skill training can be used by using different surfaces or adverse conditions, such as training in colder weather for sled dogs. This will help with avoiding injury on race day or a trial weekend. And finally, health checks will definitely prevent injury. Going to see a specialist will help you evaluate for signs of overtraining, so medical issues can be prevented very early on instead of after they happen. By doing all of these things, you are able to keep your animal athlete healthy and happy.